Okay, this is Dr. Val Jones from GetBetterHealth.com, and today we will be interviewing Jeff Donnell from No More Clipboard.
Correct.
And it's really exciting to have you here, Jeff, because I've already been speaking well of you on ABC News, where I talked about a sneak preview of HIMSS and some of the interesting things that I expected to see. And you were one of the things that I expected to see here. And I got the folks on ABC pretty excited about the concept of not having to fill out a clipboard every time you see a doctor, because that is really exhausting and unnecessary. So we want to get to know a little bit about your solution, who can use it, how does it work, and just glad to meet you in person.
Absolutely. We appreciate the opportunity, and anything we can do to get rid of that evil clipboard and kind of erase that from the medical community, that's what we're trying to do.
Perfect. So just give us the 40,000-foot view of your company, how it started, and what it does.
Sure. The concept actually grew out of that idea of going to a doctor's office, having them hand you a clipboard when you first show up for your appointment. And people sit in the waiting room and struggle to remember all these details. What was the name of that medication that I was on? When did I last have that tetanus shot? Those sorts of things. And we conducted a tremendous amount of research, both with consumers as well as healthcare professionals. And what we learned from consumers is they're aggravated and frustrated, and then they can't believe that in this day and age, with all this modern technology, that they still have to go and fill out this paper registration form. I mean, you can call Domino's Pizza, order a pizza, and they recognize your incoming phone number on the computer. They know that you get 2 pepperoni pizzas every week, and they know that you want it delivered at this time on Thursday evening. You go to your doctor's office, and it's as though they've never seen you before. So that's part of the problem. But the other part of the problem is what happens once you hand that clipboard over, because that poor medical professional gets this form that is probably not very legible, and you have to question its accuracy, and it's probably not complete. And where you really run into problems is things like medication errors. What was the name of that medication? I think it's this.
It's the blue pill.
It's the blue pill. Or they might write down what they think the name is, which is not necessarily correct, or
it's latex.
Yeah, whatever it is. It could be something that causes significant problems later. It might be an allergic reaction. It might be an intolerance or a contraindication with another medication. So anything we can do to eliminate those problems, or at least minimize them, that's sort of our goal. And again, our name says it all. It's No More Clipboard.
Well, your name does say it all, but I'm a little mystified about how this works on the back end, for the doctors, and okay, so now we're not allowed to have any more clipboards, but how do I integrate that with my process, and how do I do it? Go ahead.
Right. Well, one of the things that with No More Clipboard, the patient can go in and create this online medical record. So part of the value for the consumer is to be able to compile and manage their data all in one place. But the other part of the value is to be able to share it with your physician, and to share it in a way that integrates into their existing workflow. So in No More Clipboard, you can go in our database, find your doctor, and say, I want to send my PHR to them, and we take care of delivering it. Now, in this day and age, we would love for it all to go electronically, but unfortunately, 80% of physicians are still using paper charts. So one of the things that we can do is we can actually deliver the personal health record on paper to that practice that you select. And we can even deliver it on the specific registration forms that are used by each individual practice. So that's one of the added value pieces that we can offer to the physician is send us your forms, we'll scan them in, and we'll match up the contents of No More Clipboard with the fields on that doctor's form. So not only do they get all this information in advance, and the patient's filling it out at home where they're probably going to be more able to get the accurate information, but when it arrives at the practice, it's going to be on their same form that they use each and every day. So they don't have to hunt on a strange form, where are the medications, where are the allergies, those sorts of things. No change to their workflow, but what they get is a form that is more legible, accurate, and complete.
It's more legible if my form isn't a PDF file of a photocopy of something, right?
True. And again, that's why what we're sending is this electronic data, and it's peppered with the information that practice is used to seeing in the form that they're used to seeing it.
But let me just ask you, so let's pretend I'm one of those 80% that has paper clipboard type forms right now. So if I faxed that to you and said, "Look, this is my form," what would you make a digital version of it, or would you, put that as a PDF and send it to the patient?
Well, if one of the things that we enable, for example, if I as a patient want to get copies of my past medical records from my doctor, we actually provide the practice with a barcoded fax back cover sheet that's unique to the patient. So anything that they want to send to that patient, they can just attach it to that cover sheet, put it on the fax machine, and that will automatically send it into the patient's No More Clipboard account. So there, they can open up that document, take a look at it, print it out, do with it what they want. And then again, on the practice end, we can send it to them by fax. We can send it electronically to a portal in their office. And then if that practice does have an EMR, we can also integrate No More Clipboard with that electronic medical record system and send the data electronically in a form that it can actually be integrated right into the electronic medical record.
So most commonly, how do doctors use No More Clipboard?
They use it a couple of different ways. One is to streamline patient registration. Some doctors are passive recipients of a send from No More Clipboard that the patient has initiated. But one of the things that we're doing a lot of these days is building patient portals for physician practices. And as an example, you'd go to your doctor's website, click on a patient registration button, and it would open up No More Clipboard, but it would still look like the practice website. And as part of setting that up, then we engineer it so that the patient can go in, fill out the personal health record, answer any additional questions that are unique to that practice, and then they click a button and it gets sent right to the practice. So from a practice point of view, again, you're getting rid of that need to get all this information in the waiting room. The other thing then is once you've set up that portal, you've got a secure connection between the patient and the practice. And with that connection established, we can also layer in things like online appointment requests, online prescription refill requests. I just got my invoice and I have a billing question, or I may even have a routine clinical question, and even things like online bill payment. So you combine the personal health record with that additional functionality, and you're adding tremendous value to the practice because, for example, now you reduce phone call volumes. All these people calling, "Hey, can I get an appointment next Thursday?" or "I need a medication refill." Most practices have somebody whose primary job is to answer phone calls and then do the behind-the-scenes work and then get back to the patient. And we can reduce that by as much as 50%.
Okay, well, that sounds great. Well, we have some questions from our chat room. Hang on one second.